This lecture is entitled Cushing's syndrome and topical ocular steroids, and I'm presenting it because it's one of those seminal cases that has changed my practice during my career, and it reminded me of how even the most seemingly innocuous drugs can lead to life-threatening iatrogenic complications. So I'd like to present the case of an 18-year-old Indian Asian male student. He was a high myope, -9 in each eye, and had had right and left chronic anterior uveitis for about 6 years, managed in various other parts of the world. When he came to see us at the age of 18, he had bilateral cataracts, bilateral pressures varying between 40 and 50 millimeters of mercury, bilateral chronic anterior uveitis, bilateral optic neuropathy, and over the few months before he'd seen us, he'd experienced a rapid reduction in his vision. When we dug deeper into his previous ophthalmic history, we managed to gain some information from the previous units, and he'd had a diagnosis of bilateral idiopathic uveitis for 12 years since he was 6 years old. This had been fully investigated twice previously with no underlying systemic cause found. In particular, there was no evidence of juvenile idiopathic arthritis, TB or sarcoid. During his teenage years, he'd had 3 periods of relatively high pressure spikes, which had all been managed with topical therapy and were short-lived. But he had been on a maintenance therapy for his uveitis for many years of gutty prednisolone acetate 1% twice a day to both eyes. At the clinical presentation to our glaucoma unit, his acuities were 612 minus right and 618 minus left. There was a left RAPD, and initial intraocular pressures were 42 millimeters mercury in each eye. And these were quite refractory to medical therapy. He had bilateral active anterior uveitis, bilateral anterior cortical cataracts, which were very visually disabling with a lot of glare, and his vertical cup-disc ratios were right 0.4 and left 0.95.
If you enjoyed this lecture so far, please subscribe to http://iop.vision. I hope you enjoyed this series as much as we have putting it together. Thank you.